Hey everyone, welcome back to the channel. Today, we're diving into an important topic that I get a ton of questions about. Benzodiazepines. We're going to break down what they are, why your doctor might prescribe them, and I want to make sure you're aware of some of the risks and benefits involved. Remember that while I'm giving you all the need-to-know info on benzodiazepines, this video is for informational purposes only and doesn't substitute for the guidance of a medical professional. We'll cover what health conditions they are used for, their contraindications, interactions with other medications, and any cautionary warnings. Plus, I'll be listing the 10 most common benzodiazepines that I see prescribed. Let's get started. First up, we have diazepam, more commonly known by its brand name Valium. Now, diazepam is like the Swiss Army knife of benzodiazepines. It can be used for a variety of conditions. It's FDA approved for anxiety, but I've seen it prescribed for muscle spasms and seizures too. It works by increasing the effects of a neurotransmitter called GABA in your brain. GABA basically acts like a brake pedal for your brain, slowing things down. So when you increase GABA, you feel calmer and more relaxed. Now, because it can make you sleepy, it's super important to avoid alcohol and anything that depresses the central nervous system. Also, be extra cautious driving or operating heavy machinery after taking diazepam because it can impair your coordination and alertness. If you have any questions about whether diazepam is right for you, definitely chat with your doctor. They'll be able to assess your individual situation and help you make the best decision for your health. Next on our list is alprazolam, better known as Xanax. You've probably heard of this one, as it's commonly prescribed for anxiety and panic disorders. Just like diazepam, alprazolam boosts the effects of GABA in the brain. Now, alprazolam is fast-acting, you'll feel the effects pretty quickly, but it's designed for short-term relief. Long-term use can lead to dependence and withdrawal symptoms, so it's crucial to follow your doctor's instructions carefully. There are also some potential side effects to be aware of, like drowsiness, dizziness, and changes in appetite. And just like with diazepam, it's super important to avoid alcohol while taking alprazolam. Let's talk about lorazepam, also known as Ativan. Lorazepam is another versatile benzodiazepine, often used to treat anxiety disorders. It's also commonly used as a pre-anesthetic medication because of its sedative properties. Think of it this way: if you're feeling anxious before a big presentation or a medical procedure, lorazepam can help take the edge off and calm your nerves. Just like the others, lorazepam works by enhancing the effects of GABA, leading to a sense of relaxation and reduced anxiety. Remember, though, that lorazepam should only be taken as prescribed by your doctor. Moving on to clonazepam, often sold under the brand name Klonopin. This one is a bit different from the others we've discussed so far. While it can be used for panic disorders, clonazepam is also often prescribed for long-term management of seizure disorders. It works in a similar way to the others, by increasing GABA activity in the brain to reduce nerve excitability. This is especially important in seizure disorders where uncontrolled electrical activity in the brain is a key feature. Clonazepam is a long-acting medication, which means it stays in your system for an extended period. This can be beneficial for people who need around-the-clock control of their symptoms, but it also means it can take longer for the drug to be eliminated from your body. As always, it's crucial to discuss any concerns or questions you have about clonazepam with your doctor to ensure it's the right medication for you. Now let's talk about temazepam, which you might know as Restoral. If you struggle with falling asleep or staying asleep, your doctor might prescribe temazepam. It's a benzodiazepine specifically designed for short-term treatment of insomnia. It works by slowing down your brain activity, making it easier to fall asleep and stay asleep throughout the night. But here's the catch. Temazepam is meant for short-term use only, typically no longer than a few weeks. Why? Well, your body can develop a tolerance to temazepam over time, making it less effective. Plus, long-term use can increase the risk of dependence and withdrawal symptoms. Let's move on to chlordiazepoxide, also known as Librium. Now, chlordiazepoxide is a bit of a veteran in the world of benzodiazepines. It's one of the first benzos ever discovered and is still commonly used today, primarily for anxiety and alcohol withdrawal symptoms. You see, when you're withdrawing from alcohol, your central nervous system can go into overdrive. This can lead to anxiety, tremors, and even seizures. Chlordiazepoxide works by calming down this overactivity, making the withdrawal process smoother and less intense. However, just like with any benzodiazepine, long-term use of chlordiazepoxide can lead to dependence, so it's important to use it only as directed by your doctor. Next up is oxazepam, marketed as Serax. It's another benzodiazepine used for anxiety and alcohol withdrawal symptoms. Oxazepam works in a similar way to chlordiazepoxide, enhancing the effects of GABA in the brain to promote relaxation and reduce anxiety. One thing that sets oxazepam apart is that it's metabolized a bit differently in the body compared to some other benzodiazepines. This can be beneficial for people with certain liver conditions. Let's talk about midazolam, often sold under the brand name Versed. Now, midazolam is a bit unique on this list because it's primarily used for sedation before medical procedures. If you're having a colonoscopy, a minor surgical procedure, or even dental work, your doctor might give you midazolam to help you relax and feel more comfortable. It works quickly and has a relatively short duration of action, making it ideal for these types of situations. Now let's discuss triazolam, known commercially as Halcion. Triazolam is another benzodiazepine specifically designed for short-term insomnia relief. If you're having trouble falling asleep or staying asleep, triazolam can help you get the rest you need. But just like temazepam, it's essential to use triazolam only as directed by your doctor and for a short period. Long-term use can increase your risk of dependence and tolerance, making it less effective over time. Last but not least, we have flurazepam, often sold under the brand name Dalmane. Flurazepam is another benzodiazepine used to treat insomnia. It works by promoting sleep and reducing nighttime awakenings. However, flurazepam is a long-acting benzodiazepine, which means it stays in your system for an extended period. While this can be helpful for people who have trouble staying asleep, it also means that you might experience some lingering drowsiness the next day, especially when you first start taking it or if your dose is increased. As always, chat with your doctor about whether flurazepam is right for you. That's a wrap on our deep dive into benzodiazepines. We've covered a lot of ground today, from understanding how these medications work to exploring the potential risks and benefits of the 10 most commonly prescribed benzodiazepines. Remember, always consult with your healthcare provider before starting or stopping any medication, including benzodiazepines. They'll be able to assess your individual needs, consider your medical history, and help you make the most informed decision for your health. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more informative content. Stay healthy and see you next time.